While the nation's leading health experts say the coronavirus fight is far from over, the president has had a more optimistic assessment. Here now to fact check the president, NBC News political reporter Jane Timm. Jane, yesterday the president stood next to a banner that said America leads the world in testing, and he said that testing in the U.S. is outpacing the world. Let's play that.
This week, the United States will pass 10 million tests conducted, nearly double the number of any other country. We're testing more people per capita than South Korea, the United Kingdom, France, Japan, Sweden, Finland, and many other countries, and in some cases combined.
So walk us through the actual numbers, Jane. How does U.S. coronavirus testing compare to the rest of the world?
You know, that banner might have been more accurate if it said the U.S. is catching up to the rest of the country, the rest of the world in testing. Okay. So the U.S. is running a lot of tests, but we're a very, very big country that's been very badly hit by this pandemic. Other countries are testing at higher rates of per capita. You heard him cherry pick data points, but Denmark is testing almost twice who we're testing per capita. Italy, Germany, Russia, another big country, testing a lot more per capita. And that's the measure that really matters, because it's how many people in your large country can you test. And what's really key to understanding this, I think, is how we're testing now versus how we were testing 2 months ago when this pandemic really heated up. One of the points that I went back to when I was looking at this and seeing that, you know, Germany is testing more, I went back and looked at March 9th, which is the week that NBC sent me home. As I recall, Broadway shut down in New York. Really, things started getting very, very real. And that day, that week, we did 34,000 tests. Germany did 127,000 tests in a country that is 4 times smaller than us. And every test you do, every test you can successfully isolate a case, take them out of the chain of infecting other people, it saves lives. So the earlier you test, the more aggressively you test, the better it is. So while we're catching up now, and that's great, everyone wants to be caught up, it doesn't mean we're leading the rest of the country. You know, Trump mentions that South Korea, we're testing more than them, and our states are testing more than South Korea. Well, South Korea has had less than 300 deaths. We've had 80,000 deaths. South Korea has pretty much successfully contained their outbreak, and they're still struggling the way most countries will once they can get it into a containment strategy. But we're in an outbreak, and that's where our testing is. So we keep going up, but South Korea, you know, their current outbreak is because they had a positive case at a nightclub recently, but their nightclubs are open, you know?
Yeah, different situation over there. They seem to be on the other side of this. Jane, the president also said the U.S. mortality rate is one of the lowest in the world. Let's play that.
I think one of the things we're most proud of is this just came out, deaths per 100,000 people, So deaths per 100,000 people, Germany and the United States are at the lowest rung of that ladder, meaning low is a positive, not a negative.
So, Jane, let's look at the numbers here again. Is the death rate in the U.S. one of the lowest in the world?
You know, we are on the lower end of the world. We have fantastic healthcare and advancements and lots of great medical providers. So we are in the lower rung, but we're not the lowest. It's not like we're in the number 1 and 2 with Germany, Japan, South Korea, other countries that have had lower mortality rates. And experts say these mortality rates, we're not sure how accurate they are, because it's clear that our testing is not catching every infection rate, every infection out there. There's a lot of asymptomatic carriers, it appears. And Fauci also said today in his testimony that there's probably people who died of this disease that we don't know died of this disease. So right now, it's a little too early to be touting our mortality rate as a huge success when we're still really in the early parts of this war.
Jane, here's what President Trump said about the number of new cases in the United States. All right, Jane, we had an issue with the tape there, so I'm going to tell you what it said so it's a little easier to fact check in case people didn't hear it. Yesterday, President Trump said the numbers are way down from what they were 2 weeks ago. The numbers are really coming down very substantially. This weekend was one of the lowest we've had. The numbers are coming down very rapidly all throughout the country, by the way. So let's fact check 2 points here. First, how do the numbers now compare to 2 weeks ago?
You know, the numbers look better than they did 2 weeks ago because we have had 2 weeks of a lot of stay-at-home orders in a lot of states and much more containment. There's been a lot of progress in New York City, particularly where it was incredibly hard hit, and New Jersey, Massachusetts. So there are some successes here, but we're not, out of the woods by any stretch of the imagination. And you look at that numbers and we're more on a down slope than we were 2 weeks ago when it seemed like we were still sort of in that, perhaps that peak. The curve had not been fully flattened. But what we're also seeing is other places are seeing surges come through, particularly places without stay-at-home orders that have less mitigation. And the White House has documents that they're seeing surges in Tennessee, in Texas, in Iowa, where we have an indication that places without stay-at-home orders or with workplaces that were seeded by an early infection are seeing a lot more infections. So successes do not preclude other problems elsewhere.
Jane, I think you alluded to this here, but the president also said the number of cases is down nationwide. But NBC News has obtained undisclosed White House data that shows otherwise. What are we learning there?
So what we're learning is that there are more places than the White House would like to talk about, would like to celebrate, where we're seeing big problems. Des Moines, Iowa is one of those. There's a lot of travel from places like New York to Des Moines, and they were likely seeded pretty early with this infection as it came over from other places, from Europe, we've learned. And this is what's going to happen is when you stamp it out somewhere else, you're going to see it pop back up elsewhere. And when you proclaim victory really early, experts worry that people are going to loosen their social distancing, that they're going to say, look, the numbers are great. President Trump says it's all doing well. I want to go to the beach or to the park or to see my friends this weekend, when in fact, certain areas are not well contained. And one of the things that's important about those numbers that we see going down in a lot of states is that testing isn't even at some of the, in many states, testing isn't at the point where the estimated infection rate is. So we're not even testing every estimated infection rate. So the confidence that we know that infection rate being low is not great. That basically what experts say, we don't have enough testing to actually know if the numbers are going down in a lot of these states where testing is very limited.
Jane, you fact check everything for us, even a soundbite that I had to read to you. Thank you so much. Always great to have you with us. I hope we see you again soon. Thanks for rolling with our technical trouble.
Thanks, Allison.
CDC Director Dr. Robert Redfield also warning senators today about reopening the country too soon.
It's important to emphasize that we're not out of the woods yet. Battle contends in wee months, but we are more prepared. We need to stay vigilant with social distancing. It remains an imperative.
NBC News medical correspondent Dr. John Torres joins me now. And Dr. John, that really seemed like the overriding theme today, a warning that we should be careful about reopening too soon. What were the biggest headlines for you from today's testimony?
And I think, Allison, you're exactly right. That was probably the biggest headline of we need to get things back into order. We need to start opening up. We understand that, but at the same time, we need to make sure we do it very, very safely and in the right way and right fashion so we don't get more illness, we don't get more outbreaks, especially once we start school in the fall. What they said were a couple of different things. One is we're looking at kind of short term and the therapeutics that are coming out right now. And are we going to get therapeutics? What's working? What's not working? Remdesivir seems to be the most promising, but at the same time, only works in certain cases, so we're looking at other ones. Then they started talking about, okay, the fall, once we know it's going to come back, we start getting people to school. You have to remember that going back to school, there's not going to be a treatment, there's not going to be a vaccine. We need to do the social distancing and other factors in order to keep people safe, and at the same time, have the ability to contact trace, to test. Testing was a big issue throughout there. And then they talked about the vaccine, which is kind of the long-term policy, the long-term strategy of getting that done and what it's going to take to actually get that done. So it was 3 different phases they went through, and they talked about how all those phases, we need to make sure we do them appropriately. And the big concern is we're going to start doing things too quickly, and we're going to have more outbreaks without being able to control them, Allison.
Dr. John, I want to dig a little deeper with you into all of those headlines. I want to get your take first, though, on a debate during the hearing about reopening different parts of the country. Senators Paul and Murkowski made the case that their states, Kentucky, Alaska, haven't been hit as hard as hotspots like New York. Is it safe to reopen rural areas that may not have had as many coronavirus cases as a big city like New York?
And Allison, I think what you heard during the Senate hearing was exactly what the experts are saying, is that it depends. And it depends if you have everything in place to do it right and do it correctly so you don't have outbreaks. So granted, there are some areas that don't have as many cases. And those areas you can look at starting to open things up. But at the same time, you have to have certain things in place. You have to have that 14 days of a downward slope of cases and make sure that that is happening, because that means that things are getting under control. At the same time, you have to have the hospital capability to be able to take care of surges. But as equally important, you have to make sure you can test people, either test them all or do what they call surveillance testing, which is test certain amounts of the population, certain percentages, to get an idea of what's happening in that area, isolate people that test positive, and then contact trace people who have been in contact with somebody who tested positive. And those are parts of the ingredient we don't necessarily have right now. So that's the big concern. If all that's not in place and people start opening up too soon and people start forgetting about social distancing, start getting too close to each other, it's going to spread again. It's going to turn into more outbreaks, which every expert is very concerned with, particularly the four you heard talking today.
Hey, NBC News viewers, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here, and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.